When should I restart my diabetes injection after having surgery? Speak with your doctor about restarting after surgery, typically once normal eating resumes and bowel function returns with surgical team clearance. If you've had surgery and you're wondering when it's safe to start Mounjaro again, this is really important to get right. In the UK, Mounjaro, which contains tirzepatide, is licensed for managing type 2 diabetes. Tirzepatide is also available under the brand name Zepbound for weight management. It's effective for blood sugar control and appetite regulation, but it does slow down how quickly your stomach empties. That's one reason why your surgical team may have asked you to pause it before your procedure. Now you're recovering, the question is when to restart. The short answer is this: you should typically wait until you're eating normally again, your bowel function has returned, and your surgical team has given you the all clear. That timing varies quite a bit depending on what type of surgery you've had. Let's talk about why this matters. Tirzepatide stays in your system for several days. It slows gastric emptying, which is helpful for blood sugar control and appetite. But during anesthesia, that delayed emptying can increase the risk of aspiration. That's when stomach contents come back up and potentially enter the lungs. It's a serious complication that can lead to pneumonia or pneumonitis. Now, it's worth knowing that UK guidance from the Centre for Perioperative Care and the UK Clinical Pharmacy Association suggests that many people can continue weekly GLP-1 treatments before elective surgery, but this decision is always individualised by your anaesthesia and surgical team based on your specific situation and any gastrointestinal symptoms you might have. When you're recovering, your body needs time to get back to normal before you reintroduce a medication that affects your digestive system. For minor procedures, you might be able to restart quite soon. And once you're eating normally and feeling well, your doctor may give you the go-ahead. But for major surgery, especially abdominal or gastrointestinal procedures, you'll need to wait longer. Your bowel function needs to return properly first. That means you're passing wind, having bowel movements, and tolerating food without issues. If you've had any post-operative complications, that changes things too. Nausea, vomiting, infection, or something called an ileus, which is when your bowel temporarily stops working properly. All these mean you should hold off on restarting Mounjaro until those symptoms have completely resolved. Your surgical team and prescribing clinician will consider your specific procedure, how you're recovering, and your personal risk factors to decide the right timing for you. Now, if you have type 2 diabetes, you might be wondering how to manage your blood sugar while you're off Mounjaro. This is something to discuss with your healthcare team before your surgery. Some patients may need temporary alternative treatment to keep blood glucose stable during the interruption. Others might continue with metformin if they're already taking it. Your diabetes team can create a plan that's right for you. It's also worth knowing that if you've been off Mounjaro for a prolonged period, you might need to adjust your dose when restarting. This is something you'll need to discuss with your prescribing clinician or diabetes specialist. Don't just restart on your own. So, when should you contact your doctor? If you're experiencing ongoing nausea, vomiting, or you're unable to eat normally, don't restart Mounjaro without speaking to your healthcare team first. If you have type 2 diabetes and you're concerned about your blood sugar levels whilst you're off treatment, reach out for guidance. And if you're unsure whether you're ready to restart, that's absolutely a reason to get in touch. Remember, this is general information based on UK practice guidance. Your individual situation might be different. Always follow the specific advice from your surgical team and prescribing clinician. They know your medical history and the details of your procedure. To recap, wait until you're eating normally and your bowel function has returned before restarting Mounjaro. Get explicit clearance from your surgical team, and if you have diabetes, make sure you have a plan for managing your blood sugar during the interruption. Have you had surgery whilst taking Mounjaro? What questions did you ask your healthcare team? Drop a comment below. And if you found this helpful, give it a like and subscribe for more evidence-based health information from Bolt Pharmacy.